What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host Keoni, and today we have a special guest, Dr. Sarah Joy Cundiff. Dr. Sarah Joy got her bachelor's in kinesiology from Washington State University. Go Cougs! She got her doctorate from the University of St. Augustine in physical therapy, and she has now, we graduated from the same graduating class, but she specialized in pelvic health and obstetric physical therapy. So one, Sarah Joy, thank you for joining us. And then can you kind of tell us a little bit about what you're currently doing and what those words mean?
Yeah, so I am a physical therapist and I specialize in treating pelvic floor specifically, which is the pelvic physical therapy. And then obstetric physical therapy is the treatment of women who are pregnant and postpartum.
Okay, awesome. So as far as kind of one, where are you practicing right now?
Yes, so I am a physical therapist in Montgomery, Alabama. I'm currently with Rehab Associates.
Okay, awesome. And so how did you, because I know we both went to PT school in the same class, how did you kind of find your way into this? It was maybe a lab for us, like one day.
I don't think we even had a specific full lab on it. We had an assignment that we had to do, and we were grouped by interest, and I put on there women's health and started learning about what pelvic physical therapy was and how physical therapy could help women in particular with things like that. And then that grew into additional trainings and additional internships, treating the pelvic floor in men, women, and children.
Oh, wow. So did you have a rotation that was completely pelvic floor?
Yes. So I had one rotation that was partially pelvic floor and one rotation that was completely pelvic floor.
Okay.
So,
okay. And then, so when we talk about the pelvic floor, for just kind of the layman, what are we talking about? Are we talking about muscles, ligaments, structures? What kind of things are we mentioning?
Yeah. So the pelvic floor refers to a group of muscles, which basically sits, it's kind of shaped like a bowl at the bottom of the pelvis. So it's skeletal muscle like anywhere else in the body. So it's the same type of muscle as you would find in your biceps or your quads, but it just sits at the bottom of the pelvic floor and it serves a lot of different functions.
Mm-hmm.
So it does the voluntary contract and relax like you do with any other muscles. It is a really important part of the core support system, and it helps to support us with relaxation during using the restroom, during sexual activity. And then it also helps with kind of a sump pump mechanism, bringing swelling and fluid back up from the lower legs.
Yeah. Yeah, it's super important for people to kind of realize that it's part of the core. And that's what I try when I'm talking to my patients, even just about lower back pain, just kind of demonstrating that the diaphragm, the TA, the multifidus, and then the pelvic floor all kind of make this wall that supports the abdomen and the lower part of the spine. So obviously the pelvic floor is a super important part of that.
Yeah, I always refer to the pelvic floor as the floor of the core. So if you are missing one piece of that core support, you may have pressure going to that weakest link. And so it's important to make sure that everything in the core is strong and working well for you.
Yeah.
It seems like everything in the core or the weak link in the core is usually going to be the pelvic floor, right? It's not something that people really think about training,
not
so
always.
to speak.
It depends on the person. But I think one thing with the pelvic floor is that like people are very conscious when they're exercising of, oh, hey, I need to exercise my muscles in my back.
Right.
Hey, I need to exercise my abdominal muscles. But the pelvic floor is the piece that often people don't already have incorporated into their exercise programs. They're not usually consciously thinking about it and using it.
Yeah, I'm not sure how we would know. I mean, we'll get to it, I'm sure, in this podcast, but how do people even know how to work that? That's the thing.
Yeah, I was going to ask, is there any cue that you give, Sarah Joy, like in the gym or just in general for people when they are exercising for either engaging or just properly using their pelvic floor?
Yeah, so there are a couple different phrases that we use to kind of engage the pelvic floor. There was actually a study done on what the most effective phrase for the most people is. And the best way to think of it is trying to squeeze your anus shut.
I know that one.
Yes, I know that one too. And that's the thing. So do you recommend people like squeeze those pelvic floor muscles periodically? Or I mean, like, how do you go about training that?
Yeah, so I think it's really important to kind of take note of what's going on in your body. So if you have any sort of hypertonicity, any sort of tension in those muscles, and things like the things that would cue you into that could be things like constipation, things like a pain with using the restroom or with sexual activity. If you have any of those types of symptoms, then you don't want to be doing strengthening of the pelvic floor, because we need to make sure it's at normal tone before we strengthen. But if you're having no issues, no current difficulties that you've noticed at the pelvic floor, then yeah, adding in that pelvic floor component to your normal exercise routine can be helpful.
Yeah, I've had a number of patients over the years, especially men, who they would describe, they would get diagnosed as like prostatitis, or get diagnosed as some type of, swelling of the prostate, BPH or whatever. And ultimately ended up being like pelvic floor tightness, where they just have a pain where they felt like they were, I don't know, kind of almost like sitting on a golf ball. But it was like, once the doctor cued them into maybe they're holding a lot of tension there and everything, that seemed to be the key. So I see this kind of a lot in men also.
Mm-hmm. Yeah. And I think it's important to note that it's not mutually exclusive. Those two things. We often talk about how people can carry tension in their shoulders, right? So we think about, okay, well, when people have stress or anxiety or pain, that can manifest in tension in the upper trap. The pelvic floor is another place where that can happen commonly. So if somebody has an issue at their prostate or at their bladder that they need medical attention for, they could also have either a reaction to that by having issues at the pelvic floor.
Now, were the painful urination, pain during sexual activity, those sorts of things, are those the typical things that kind of prompt people to seek pelvic floor physical therapy?
Yeah, so I think pain and leakage are the main two things that I see people coming in for.
Okay. Typically, how do they find you, SJ? By that point, have they gone through the ringer like Keoni and I are kind of used to, and we're used to as physical therapists? They've seen a doctor, they've gone through this specialist and and then they end up in our office far too late. Where along the journey are they kind of finding you?
Yeah, so hopefully towards the beginning.
Yeah.
Which never happens, I'm sure.
Well, it does occasionally.
Okay, good.
But yes, so a lot of what I see from people is that they have heard about pelvic physical therapy, or they've seen something online and they've kind of brought it up to their doctor as an option. And so that is a big thing, that patient education piece. If you know your body and you say like, hey, this might be something I want to try, communicating that is great. But yeah, I often see people who have been seeing a urologist or an OBGYN. Those types of providers are usually sending people to me as a form of conservative treatment.
Yeah, absolutely. And then so we were talking about pelvic PT for men and pelvic PT for women, and then I know there's women's health PT. So can you kind of break down the difference in what someone would expect when they do see you for each one of those specific disciplines? Are you still with us? All right, little break. We were talking about kind of, Sarah Joy, the difference between pelvic PT for men, pelvic PT for women, and then also women's health PT, and kind of the differences between those. And obviously, we kind of alluded to it before that it is important for men to be aware of this. But obviously, since it's the Well Man's podcast, can you speak a little bit more on pelvic PT for men and kind of what's going on there and what we should expect in a visit and that sort of thing?
Yeah, so pelvic physical therapy for men can include treatment for a variety of problems. So there are a lot of pelvic dysfunctions that can affect both men and women. So urinary leakage, urinary frequency, constipation, leakage of stool or gas, pain in the pelvic region, and generally those core support issues as well. So those are the common ones that you see with both men and women. But in addition, men I will see for erectile dysfunction sometimes, and pre and post prostatectomy.
Okay. So for men, definitely there's a component to improving sexual performance then.
There can be, yes. Yeah. So the pelvic floor helps support during sexual activity, and there's a big component of that contraction and relaxation to sexual activity. And so if your muscles are weak or if your muscles are tight, there can be difficulty with that function.
And I imagine the same thing for women then too. Yeah.
And then, so when someone comes in, let's say I was coming into your office, Sarah Joy, what does an evaluation kind of look like? Or what are those, what should people expect? Because obviously it sounds kind of personal. And then, someone would be nervous about going to the appointment. So what do the appointments kind of look like?
Yeah, so it is definitely one of the more personal forms of healthcare. We always start with chatting. So I'm always asking people like, hey, what's going on? Tell me about what you've been noticing, and then asking questions about all the different functions of the pelvic floor. And then I am doing an evaluation. So physical therapists, we're musculoskeletal experts, right? So we're looking at the muscular system, we're looking at the skeletal system, and we're looking at the neuromuscular system. And so my evaluations are the same as any other physical therapist in that respect, is that we're just looking at those systems in the body. We're just looking at them in the pelvic region specifically. So I think a big piece of pelvic physical therapy that people are a little bit apprehensive of, especially with men, is internal examination. So internal examination for men looks like intrarectal an exam. And it is not a 100% necessary thing. If the patient is uncomfortable with it, we don't have to do it. But it gives us a whole lot of really important information. There are certain muscles that we can't test externally. And so that internal testing is a really important piece, but it's something that we don't have to do day one.
Yeah, but so that internal testing, both men and women, kind of allows you to gain some knowledge about the tissues that, like you said, we can't palpate or feel outside of the body. And that's really what you're looking for: length, tone, tension, that sort of stuff.
Yeah.
Okay. And then I know with men, are there any like objective, like for instance, just a physical therapist trying to look at walking speed? We have like a quick walking test. Are there any typical outcomes that maybe someone could use at home to kind of monitor their own pelvic health? Like I'm thinking of kind of like how much you're urinating, that sort of thing.
Yeah. So normal urination is about 6 to 8 times per day. And then about 0 to 1 times per night. So if you're noticing that you're using the restroom significantly less than that or significantly more than that, that may indicate that you might want to talk with a healthcare provider on that. For bowel movements, it can be as little as 3 times a week for normal, or it can be as many as 3 times per day for normal. So again, looking at that normal range. And then any sort of pain in the pelvic region. So pain at the rectum, pain at the perineum or the testicles or the base of the penis. Any of those sites of pain are something that you should be talking about with your healthcare providers.
Okay. And so overall, like just to rehash the numbers, you said 6 to 8 times urinating throughout the day, 0 to 1 at night, and that's for both men and women. Are you ever concerned with kind of the volume that's coming out, or just more so the frequency?
Yeah, so those normal values are looking at the frequency, but that's one of the things. Volume is one of the things I'm asking about for sure. If you are urinating once in the morning and then 20 minutes later you're back in, but only, getting a few drops out, then that can indicate that there's something going on that we can be working on.
Yeah. And then I know you mentioned kind of pre and post prostectomy. Can you talk a little bit about what that looks like and why it is so important?
Yeah. So where the prostate sits below the bladder, it provides a passive support. And so that passive support is really important for continence. And when you have a prostatectomy, oftentimes, common treatment for prostate cancer is that radical prostatectomy where they remove the prostate. When the prostate is removed, you're removing that passive support for the bladder. And so what my job is then is to help increase that active support from the pelvic floor to help compensate for that loss. So when we're talking about pre-prostatectomy, that's the prehab, that's the strengthening, making sure that you've got the best chance for success after surgery. And then when we're looking at the post-prostatectomy rehab, that's where we are really seeing like, okay, where are the actual deficits falling, and what can we be working on?
Yeah, it's a great point. Keoni and I have done a pre and post surgery podcast with like a pre protocol and a post protocol, and it's so important for people to realize the importance of that prehab before surgery and going and getting. But that's interesting to note. I don't even think I remembered that about kind of that it provided that passive support to those structures, and then so you're compensating with that with the pelvic floor once it's taken out, essentially. Mm-hmm. And it's interesting because I know most medical doctors are typically probably not referring men to pelvic floor after they have this
Definitely not
intervention, right?
Yeah, not in my experience. They aren't. A lot of men after the prostatectomies also lose, can't get erect,
right?
Or have difficulty getting erect. And I wonder, Sarah Joy, if they got in to see you sooner, if that could be improved. I wonder if sooner is better or not.
Sooner post prostatectomy?
Yeah.
So, we're always looking for clearance from the physician on when the tissues are appropriately healed. But usually several weeks after surgery, we're getting people in and doing that evaluation. So we can be doing a lot to help the pelvic floor afterwards. And I think a common thing that I hear from patients is that their physician gave them a handout on how to do Kegels. And that is oftentimes not sufficient. I think it's really important to note that there are like different ways to do Kegels, and there are different ways to do those contractions. And so a handout, this one size fits all approach, usually isn't sufficient for everybody.
Mm-hmm. Right. And you see that, I'm guilty of that myself as a physician. I will tell people, well, check out, although because of YouTube, definitely because of Bryan, I will look for a PT that goes over Kegels and send them to like a YouTube video on that. But yeah, so there are different key ways to exercise. And I noticed there are different ways for both men and women that people may not realize.
Yes. Yeah. So I like to say that Kegels are like squats for low back pain. So if you have a patient with low back pain, if you're looking at doing squats, that can help a whole lot of things, right? But it's not a one size fits all approach. There are different kinds of squats, and there are different goals that we're going for with different squats. And so it's the same thing with Kegels. A Kegel is just a pelvic floor contraction. So we can do contractions for coordination. We can do contractions for strength. We can do contractions for endurance. And we can use those contractions to increase blood flow and actually promote relaxation of the pelvic floor. So it's really important to get evaluated to see which one specifically is most needed for you. And a physical therapist is excellently positioned to give that evaluation and that really specific prescription and that feedback on how you're doing with it.
Right. But a physical therapist, but somebody that's an expertise in what you do. Like that's the thing. Not every PT does what you do.
Right.
Yes. Yeah. Pelvic physical therapy specifically there.
Is there a website, or do you just, or, is there like a group website or so?
How do you find a pelvic physical therapist?
Yeah. Besides just word of mouth.
Yeah, so there is a website through APTA, and it is at, I believe it's aptapelvichealth.org, and it will have a button for Find a PT, and that'll show a map with all the information for pelvic physical therapists and women's health physical therapists, and you can see which specialties each one treats.
Okay.
Is SJ, could you walk us through just kind of a basic Kegel performance? I know there's a lot of variations, but just in general, everyone listening right now, how would you go about educating them through, let's say they're sitting in the car right now in traffic. How would you educate them through just kind of, I guess, kind of getting, and we know this as PTs, is kind of developing that awareness even of these muscles and these tissues down at the bottom of the pelvic floor?
Yeah. So I think the best way to start is actually laying down, because when you're laying down, your muscles aren't having to fight against gravity. And so that's the easiest way to start feeling those muscles. So I'd have people lay down and I would tell them, okay, try to squeeze your anus shut. And if you can feel that contraction, if you can feel that, that is great. If you're unsure what you're feeling or you're not sure if you're feeling the right thing, you can always take a mirror and look, at your pelvic region. And when you are using that mirror, you should see the tissue raise up and in. And so if you're seeing that contraction and then you relax that tissue and you see it relax back down, that's a good indication. So working on that piece particularly.
Okay.
Now, I think one of the really important things with Kegels is that we have a lot of muscles that try to help out. So our glutes try to kick in to help, and our adductor muscles, so the muscles on our inner thighs, try to help out oftentimes when there's weakness at the pelvic floor. So if you're sitting up and you're doing a Kegel and you're noticing that you're raising up out of your chair while you do it, you're adding in too many muscles. You need to pare it down and make sure you're being really specific with it.
Okay. Yeah, that's awesome. And what do you think about, and I know even Keoni and I have kind of debated this on the podcast. What about I've heard like trying to stop your flow of urinating is a positive way to train your pelvic floor. True, false? Your opinion on that?
Yeah, false. I never tell my patients that.
That's good to know. See, thank you.
Yeah.
I'm guilty.
So the reason why a lot of people give that instruction, the reason why a lot of physicians tell patients to do that is because it's a really clear indication of whether you're successful with that contraction, right? If you contract and the urine flow stops, then you're seeing that you're squeezing that pelvic floor, and it's a feedback to the patient, right? Now, when I was talking about the function of the pelvic floor, though, one of their really important functions is that relaxation piece to allow for using the restroom. Now, if we're getting that situational training of saying, okay, we're on the toilet and now we're going to contract, that's training the body the opposite of what we want it to be doing naturally. So we never want to encourage that contraction while on the toilet.
Interesting. Is there anything that comes to mind, kind of things that you've heard and learning, or things that have come up that are common misunderstandings like that, or common things that you'd like to clear the air on? Or is that one of the bigger ones?
I think that's definitely one of the bigger ones. And then I think also people assume that everything needs strength, right? So we always think about strengthening the pelvic floor. But we need to make sure the pelvic floor is at appropriate tone first. So if you are, using that hand mirror and watching that contraction, and you see the contraction up, but you don't see the contraction when you relax, you're not ready for strengthening. So things like that are where it's really important to get that specific feedback.
Yeah. And now, how does someone go about addressing the tightness? Individual, obviously I can imagine a tight bicep, what you would do. How do you kind of address the tightness in the pelvic floor?
Yeah, so it's skeletal muscle like anywhere else. So we use very similar techniques. So we're thinking of gentle contractions to try to increase blood flow and allow for that lengthening and shortening. We can use manual therapy techniques, so things like massage, and we can use exercises that help for lengthening and stretching that muscle. So a really common one that I use a lot is cat-cow. Cat-cow exercise actually has a lengthening and shortening effect at the pelvic floor.
Oh, interesting.
I didn't know that. Okay.
Interesting. And is that so that's a great branching off point of kind of your general like first visit HEP, the home exercise that you are sending someone with. I assume it's something like that cat cow and then maybe a Kegel, or just, and I know it's specific to everyone, but just kind of your initial thoughts or just general exercises that you would recommend for pelvic health overall. Are those two of them? And then what else do you have?
Yeah, I think the other one that's really important to mention is the co-contraction. There's a really close relationship between the pelvic floor and the transverse abdominis.
Oh yeah.
So I'm sure you've talked about the transverse abdominis and doing that core squeeze in, right?
Yep.
So that muscle, they should be able to work together. And so when you contract your pelvic floor, you should be able to contract your transverse abdominis kind of automatically. And you can check this with a cough. If you have a really good cough, you should be able to feel a little bit of tension occur at your transverse abdominis as well as your pelvic floor.
Okay.
So any exercises that are cueing that transverse abdominis, that core squeeze, are really good for core support and helping at the pelvic floor as well.
Okay, awesome.
Sarah Joy, so as far as the different issues, let me just name some off and tell me if you can help with your expertise, if you can help with these. What about prolapses of like bladder and organs and, viscera?
Absolutely.
Okay.
So when we have a prolapse, again, there's a lack of that passive support system. So oftentimes there are ligaments that are stretched, or something's going on that those organs are just falling a little bit in space. And so with the pelvic floor piece, that helps to support them actively.
All right. And what about hemorrhoids? I mean, it's a form of prolapse. It's a venous prolapse. Could you help people that have issues with that?
Yeah. So with hemorrhoids and things like that, we are not treating the hemorrhoids themselves. So, I can't prescribe anything. I can't, be fixing the actual hemorrhoids. But we look at the causes of what may have led to the hemorrhoids. And oftentimes what leads to hemorrhoids is that straining on the toilet, right?
Right.
That really holding the breath and pushing. And so that's absolutely something that I work on with people in physical therapy is decreasing that pushing, that straining feeling. And then again, that piece of when you have pain associated with any condition, you can have a muscular response that then increases tension and keeps that pain cycle going. So the causes and the results are both things that I can work on from hemorrhoids.
And what about like rule out, like if you rule everything out, somebody's having vaginal pain, right? And you rule out infection and everything else, you would be the person to refer to for that, right? If all the rule outs are taken care of?
Yeah, pelvic PT is a great place to send people who have that more general pelvic pain. So we look again at the musculoskeletal and the neuromuscular. So if there's neural sensitization that's going on that's causing that pain, that's something we can be working on. If there's a musculoskeletal cause to it, we can absolutely be working on that.
And then you talked about incontinence, right? Urinary incontinence, bowel incontinence. Those things your expertise will really help that.
Absolutely. And I think the incontinence is definitely one where there's a lot of misunderstanding on what is normal. So I hear a lot from people like, oh, well, I leak just a couple drops when I laugh.
Yeah.
But that's okay. That's just normal, right? Mm-hmm. Well, it's really common. And, it's something that a lot of people deal with, but it's not something that you have to live with, right?
Yeah.
So we can be working on strengthening for the pelvic floor.
Okay. And then you talked about erectile dysfunction for men. I guess, especially if it's due to surgery or if it's cardiogenic in nature, all of that would help, because if you're exercising those pelvic floor muscles, you actually are going to improve blood flow, I guess, to the whole area, right?
Yeah, you can.
Okay. So that's another one. And then And then just improving sexual performance overall for men and women. Am I missing anything else that, like, different types of
things
ailments
that you really focus on?
That things that can really help people that have issues there?
Yeah, I think those are the main ones that you'd see, pelvic physical therapy specifically. But I think it's also really important to mention how common pelvic dysfunction is in people who are not even having those pelvic symptoms. So there is one study that says that in non-pregnant women with lumbopelvic pain, 96% of them have pelvic floor dysfunction.
Wow.
So it's a huge number of people that may be experiencing low back pain, again, that core support piece, that may have pelvic dysfunction as well. And so if somebody is having low back pain and is coming to me for that, or hip pain, I'm always asking these pelvic questions. And I'm always seeing, like, okay, is this a piece that we're missing?
What are some of those questions, Sarah Joy, that kind of, let's say you're evaluating me for my hip pain. What few things are you including to start teasing in or asking about the pelvic floor?
Yeah, I am always asking about bowel and bladder function. I'm asking about sexual function, and I'm asking really specific questions about where the pain is.
Gotcha.
And so there are deep hip rotator muscles that can be, involved in hip pain, but are actually palpable through the pelvic floor or through internal testing. And so those questions of is your hip pain like deep, and does it feel like you can touch it, or does it feel like it's really deep, and does it change with eating, and does it change with using the restroom? So if we're having this musculoskeletal pain and it's not changing when you're eating and it's not changing when you're using the restroom, a general orthopedic physical therapist can probably be, a really great asset to you for that type of low back pain. But if it's changing with eating or changing with using the restroom, there is probably some sort of pelvic or gastrointestinal component that you really want to be seeing a pelvic PT for.
Okay, awesome. Keoni, did I steal the microphone from? Were we still going down? Okay.
No. I think I hit on everything I wanted to ask. I was just wondering if there's anything else out there that can improve it.
Is there anything else that, like, we didn't touch on that you feel like should be mentioned?
Yeah, I think the one thing that I would say is if you're feeling like you need to see a pelvic physical therapist, I would try searching pelvic physical therapists in your area, but you can also search women's health physical therapists. There's a lot of overlap between the two, but for a large majority of it, a women's health therapist would also be able to treat pelvic floor dysfunction in men.
Okay.
So looking for those both may get you more contacts in your area.
And are those separate entities, Sarah Joy, like within the APTA, the American Physical Therapy Association? Is it one big branch of pelvic physical therapy, or do they separate into men, women, and women's health as well?
Yeah, they are highly intertwined.
Okay.
So women's health physical therapy is kind of the slightly older term. And there's been a transition now to pelvic health physical therapy because it encompasses more things, and I think is less threatening and less intimidating to people who are, men, children, or trans. So it's kind of there's a lot of intertwining aspects of it. But for the most part, a pelvic floor physical therapist treats pelvic floor dysfunction, and they often will treat men, women, children, trans, etc. But if a women's health physical therapist often has additional training in things like breast cancer, ovarian cancers, things like that, menopause, for instance. And so they tend to have a lot more expertise specific to women. So there's a lot of overlap. Both are probably able to help, but doing that search for both, I think, would be best for people who are looking for pelvic floor.
Absolutely. And I'll link, so if you're listening to this in the show notes right now, I'll link the APTA pelvic floor kind of search tool. And then hopefully you can find Sarah Joy on there.
Well, then that was my question too, Sarah Joy. So will you see people virtually and all that? Or do you have to see them in the clinic? And could they contact you directly, or do they have to go through this organization?
Yeah, so I believe that you need to find a physical therapist still in your state, in your region, even with these virtual visits. But yeah, so physical therapy is definitely one of those fields that we have been moving into virtual, especially with, the times as they are right now.
Right.
And so, yeah, there are physical therapists who are doing virtual visits. It is, again, we're losing that physical exam piece and that internal examination. So, there's less information that we can get from a virtual visit, but that can be an excellent place to start.
Maybe we need to develop the to-go endoscopy camera.
Put it on the phone. Yeah, definitely.
So we went through, so I just kind of wanted to highlight some keys that you mentioned, kind of proper performance of Kegel being that lifting of, kind of feeling that contraction and lifting of the anus and the sphincter up. And you did mention kind of that is an important part of stabilizing the core. So we do want to do that when we're doing functional movements. So if you're squatting at the gym, you also want to maintain that as well. And I see you have got a great note here that I've made as well on this podcast. So you also want to exhale when you exert your force. So that kind of helps that whole cage that we were talking about, the diaphragm, pelvic floor, and then the multifidus and the TA in the front and the back, kind of work together and build that proper abdominal pressure, stabilize your spine, and thus stabilize your core or your pelvic floor. And then, urinating 6 to 8 times a day is more typical and kind of what we should be shooting for, you said. Maybe 0 to 1 time at night. We don't want to be straining when we're going to use the restroom. And then at the end of the day, it seems like pelvic floor therapy should be kind of for everyone, especially if you're having a problem.
Yeah, I think pelvic floor physical therapy is a fantastic place to go for conservative treatment. So I always tell people, like, even if you've got something that needs surgery, even if you're going on to other treatments after this, what you learn in pelvic physical therapy will give you really good tools to set you up for better success after those other treatments as well. So, if we can treat conservatively and solve those issues for you, great. If you go on to other things, you'll be better prepared for them next. So I think pelvic physical therapy is always a great place to start.
Yeah, that's awesome.
Yeah, it's great. So is there anything that people could do, like the average person that doesn't necessarily have a complaint? Should they, I don't know,
should they start doing Kegels regularly? Yeah.
So if you are wanting to add pelvic floor into your general exercise routine, I would say doing those small contractions. I like to add them into functional activities. So just bringing your consciousness and awareness to them during activities like squats or abdominal contractions, something that you're already doing in your exercise routine, because those are the normal function of those muscles. They should be supporting you during that core support. And so just bringing that awareness to them, making sure that you're using them appropriately is a great way to incorporate that into your normal exercise.
Yeah, I love that. That's awesome. In my clinic, Sarah Joy, I created a thing called a perfect patient plan. I kind of walk every patient through it, and it's kind of how I treat. And within each step of kind of the progression of our treatment is always awareness, and awareness is always there. And you're kind of keeping that in the forefront with these functional movements while still doing the pelvic floor contraction and that sort of thing. So that's awesome. Well, thanks for joining us, Sarah Joy. It was fun to see you. I haven't seen you in a year, and that was great.
Yeah, thank you, Sarah Joy. That was great, and thanks for helping me get correct information to my patients as far as the anal contraction, not to stop urination for the Kegel.
Do you want to shout out kind of where people can find you specifically, Sarah Joy, or kind of what do you want to leave people with here? We're still recording.
Yeah, so if you are wanting to contact me directly, my email is sjcundiff@rehab-associates.com. And if you are on Instagram, I have an Instagram. It's Dr. Sarah Joy.
Awesome.
And can you spell that? Sarah Joy, can you spell that, your email again? Just spell it out for them, just so they can
Sure.
have it.
So it's SJCUNDIFF at rehab, REHAB -associates.com.
And I will put it in the show notes.
All right. Thank you so much for being on.
Thank you,
thanks
SJ.